presentation on visceral manipulation and massage. So this is to get a better look at how visceral manipulation can help our clients. So before we talk about visceral manipulation, we have to ask, what is visceral pain? Visceral pain is a stimulation of the nociceptors of the inside the visceral organs. So this is called slow pain. Slow pain is caused by a stimulus on the unmyelinated C fibers inside your body. The stimulus is described as pain that builds for many seconds and up to a couple of minutes. So this is like when you stub your toe. It's not that initial sharp feeling that you feel, but more of that dull, achy feel that you feel right after. So some of the typical causes of visceral pain are ischemia or distension of the internal organs. So this can be caused due to the lack of oxygen going towards the internal organs. It causes them to work harder, and then it puts stress on the internal organs and could eventually cause organ death. So another thing that often or can happen is the connective tissue surrounding the internal organs becomes adhered, which decreases the natural movement of the organs and causing it to be very irritated. So where can you feel visceral pain? So sometimes clients will report feeling pain just superficial to where the organ actually is. Other times it can be referred. So with regards to the lungs and the diaphragm, the referral pattern goes from the anterior neck and the lateral neck and the posterior neck. So visceral manipulation can be used to target internal organs if that's what the client comes in complaining of, and as long as the clinical findings also pertain to that. So it can help with acute disorders, musculoskeletal disorders, scar tissue dysfunction or complications, emotional issues, and some health issues that pertain to certain genders, such as menopause for women and prostate dysfunction for men. So the goals of a visceral manipulation treatment are to address the general health of the body, the systems within the bodies, and the organs within the body as well. A certified visceral manipulation therapist works with the body's natural processes to increase the body's health and get the client functioning at a healthy and normal level again. So considering visceral manipulation, there are a few instances when we wouldn't want to use this type of treatment. So some of the CIs can include tumors or cysts if the client is reporting them, because we could cause more pain to the client. We could potentially rupture the cyst, and the ulcer could tear more tissue. A second contraindication is pregnancy. During the first trimester, miscarriage is very high. Possibles of miscarriage is very high, and we don't want to add to that potential. In the second and third trimester, it is impossible to reach the organs without putting pressure on the baby, and this could be damaging to mom and baby.
Another CI is any abdominal, thoracic, or pelvic surgery that is new. Due to compression techniques, we can tear open sutures and staples. Another contraindication is bleeding internally or externally. If you're externally bleeding, seek medical attention. If you're internally bleeding, with deep techniques, we can spread that around, and then it can cause necrosis to anything inside of your body. The final one is fragile skin. With deep compressions and fascial work, we could tear apart any tissue on the outside as well as inside of your body, and we don't want that. There are also many benefits when it comes to visceral manipulation as a treatment. The whole point is to be able to encourage the body to heal itself. It can also help with muscles, bones, and connective tissue to make them unrestricted on themselves and stop pulling on organs as well. Also, people sometimes with the referral pain from the organs can feel things like migraines, sciatic pain, endometriosis, and those can be also healed as well after a few treatments of visceral manipulation. Treatments usually comprise of connective tissue techniques, fascial techniques, membrane techniques, as well as compression techniques. Also, while the patient is on the table, instruct them with diaphragmatic breathing, because it can help them when you do deeper compressions. Through assessments, we can also find out many things. There could be that the pain from past massages is not going away due to the fact it's actually not muscles, but the referral pain from the organs that are affected. Also, due to the organs being irritated, there might be problems with thoracic or lumbar range of motion. Also as well, they might have some abdominal or thoracic discomfort, and if the lungs are affected, taking in deep breaths is actually very hard for them because they cannot fully expand due to the irritation. Jean-Pierre Barrel was the first one to fully introduce visceral manipulation into massage techniques. It was in 1985 that he came over to North America and got it patentized, and now it is called the Barrel Institute. For the Barrel Institute, there are certain seminars that are held in provinces or states across North America. It's a 3 to 6 day seminar that can be held. There, you will earn a certificate from your state or province indicating that you can do visceral massage. Recently, there has been some studies on visceral manipulation in regards to low back pain. There's been a trial studied by John Panagoulis, Mark Hancock, and Paulo Ferreira. In addition to physiotherapy with visceral manipulation, they have seen if it can affect low back pain as well as the functional outcomes in 2, 6, and 52 weeks. The control trial was held in Sydney, Australia at a private clinic that was based in physiotherapy. They had 64 people in the clinical trial. 64 of them received physiotherapy care along with visceral manipulation, while the other half only received physiotherapy with a placebo of visceral manipulation. For the participants, they were also asked some questions at their initial appointment. The questions were relating to a pain scale out of 1 to 10, filling out the disability index, as well as some other disability indexes relating to functions, as well as they had any GI, bladder, or reproductive type of problems. These included period cramps, period pain, along with food sensitivities, diarrhea, constipation. After getting questioned, they had functional assessments regarding vascular restrictions along with organ mobility. From there, over 6 weeks, they were able to be treated 1 to 2 times a week, but only for a maximum of 12 times. Thanks for watching our video on visceral manipulation, and we hope you enjoyed it. Since this is being uploaded to YouTube, we have links to the Barrel Institute as well as all the articles that we referenced in the video. Have a good day.